My name is Darlene Ifill-Taylor. I am both a physician and a professional singer.
I was lost and it was dark, but you were light.
I'm a general psychiatrist, so that's everybody, and then my subspecialty is child and adolescent psychiatry. That's always going to be depression and anxiety and ADHD, all the anxiety disorders, OCD, and all of that. I feel particularly drawn to young adults. I just think they're struggling. College-age kids, I love working with them. I'm particularly interested in women's health issues. So I was very, very excited upon coming here that I could work with women who have perinatal anxiety and depression. We have a new program here in the department, and I'm the psychiatric support for that. So I get to work with women every day who are depressed and either just had their baby or they're pregnant. And I just find that particularly rewarding.
Your love cared for me.
The singing came before the doctoring. My first solo was when I was 8. I particularly love classical works. And somewhere in there, decided to go back to school to get an associate's degree in music while I had my private practice and while I was raising my children. Don't know now how I did that. My husband was really supportive during that time. And I actually did it so that I could get over my fear of standing in front of people and singing it. I think that physicians don't necessarily feel entitled to do other things. You sort of start doing this work, which is the most important thing, let's be clear, and it's not as important that I go sing, but that it is important to me that I sing. And so it actually feeds you and because you're pouring out so much every day to patients, or I do. There is a freeing feeling when you can just kind of like open your mouth and get it all out there. So there's the creative part when you actually are writing a song, but singing itself, particularly in harmonizing with other people and singing, is just amazingly beautiful. Being a psychiatrist, I'm in people's heads every day, and I get to the privilege of seeing people's lives every day, and so I note what works and what doesn't work, and I just feel like life is not always balanced.
You gave me favor, gave me hope, a sweet relief.
We are so busy that the things that we love to do that feed our spirit, that's like low man on the list, and that's not good, because if you're not feeding or taking care of your spiritual self or your emotional self, that's going to impact your physical self.
With me.